What is the principle behind heat acetic acid test? Denaturation of protein. ঠিক আছে, protein structures are, what are the structures of protein we find? Primary, secondary, tertiary and quaternary. So what are the structures that are denatured by heat? Secondary, tertiary, quaternary, other than primary. So primary structure is linear peptide bonds of amino acids, linear chain of amino acid. Acha, so other than primary structure, all other structures are denatured by heat. So here we heat the sample and we get a white coagulum on heating. So any other substance that also give white coagulum on heating other than protein? Other than protein, any other substance that also give white coagulum? Phosphates and carbonates, okay, compounds with phosphates and carbonates. But adding acetic acid to that coagulum will dissolve phosphates and carbonates, not the proteins. So after heating, when we add the glacial acetic acid, so that confirms the presence of protein. Protein coagulum will be solidified, okay. So this is heat coagulation test, heat acetic acid test. So can you name other tests also for protein detection other than heat acetic acid? করানো হয়েছিল আরেকটা, না, রথেরা ইজ ফর কিটোন বডি, এখানে সালফোস্যালিসাইলিক অ্যাসিড টেস্ট করানো হয়েছিল না? সেম, যেখানে স্যাম্পলের ভেতর আমরা সালফোস্যালিসাইলিক অ্যাসিড ড্রপস অ্যাড করছিলাম আর নিচে আমরা কোয়াগুলাম পাচ্ছিলাম, ক্লাউডি অ্যাপিয়ারেন্স হচ্ছিল। এছাড়া আর কি টেস্ট আছে? হেলার্স নাইট্রিক অ্যাসিড টেস্ট আছে, সেম concentrated nitric acid, if we add in the sample concentrated strong acid will lead to coagulation or denaturation of protein structures, okay. So what are the pathological conditions where we find protein in urine? Is it normal to get protein in urine? Is it normal to find protein in urine? No. Then what are the conditions where we may find protein? Nephropathy, any kind of renal diseases. In severe cases, acute glomerulonephritis, nephrotic syndrome, okay. All these are the kidney problems where we get the protein leakage. And other than these, long-standing hypertension and chronic diabetes cases, there is diabetic nephropathy that will also lead to leakage of protein in urine, ঠিক আছে? ওকে, সো এগুলোকে কিন্তু মনে রাখতে হবে, এগুলোই জিজ্ঞাসা করা হবে, ওকে। আচ্ছা, নাও কামিং টু ব্লাড। ইজ ইট নর্মাল টু ফাইন্ড ব্লাড ইন ইউরিন? আচ্ছা, হোয়াট ইজ কল্ড ইফ ব্লাড ইজ ফাউন্ড ইন ইউরিন? Hematuria. Hematuria is when we find intact RBCs in urine. If we find only hemoglobin, not intact RBCs, it is called as hemoglobinuria. So in these cases, two causes are different, তাই তো? In case of hemoglobinuria, RBC lysis or rupture of RBCs are occurring in the system. That's why we are getting free hemoglobin in our urine. But in case of hematuria, we are getting intact RBCs because of leakage of RBCs, or there is somewhere where the arteries or capillaries are ruptured and it is coming into the stream, urine stream. So we can divide all the causes of hematuria in three parts: pre-renal part, renal part and post-renal part. Mostly in case of pre-renal part, we get hemoglobinuria. Hemoglobinuria because it is a systemic cause where the RBCs are ruptured in the system. So in which conditions RBCs are ruptured in system? Hemolysis where occurs in system in which diseases? In sickle cell anemia, in case of thalassemia, in case of malaria, dengue kind of infections, there is hemolysis in system. and in case of mismatched blood transfusion also. Okay. So, in all these cases these are pre-renal. If we categorize the causes in anatomical sequence, it is pre-renal. All the causes lies above kidney in the system. So, systemic causes or pre-renal causes are where the hemolysis is occurring in the system. Okay. And then renal causes where there is a proper renal pathology involved. Okay. So, in case of acute glomerulonephritis there may be hematuria, or in case of renal tumors, renal cancers, or in case of trauma to the kidney injury trauma, kidney tissue injury, there will be leakage of blood in urine, and in also case of impacted renal stones. If there is large stone impacted in the renal cortex or kidney itself, it may lead to hematuria. So, these are mostly the renal causes. Now come to post-renal part. What are the post-renal parts of our urinary tract? Ureter, bladder, prostate in case of males, and urethra. So, any injury to these parts, any injury, or if there is faulty catheterization or any instrumentation, this may also lead to post-renal cause of hematuria, and these are gross hematurias, okay, where visible red urine is seen. Okay. In case of prostate cancers or bladder tumors, there may be post-renal hematuria. Clear to all the causes. Okay, now coming to the test procedure. Which test we perform? Orthotolidine test to detect blood in urine. Previously we used to do benzidine test. As benzidine is carcinogenic, it is very much carcinogenic for bladder cancer. Okay. If asked why benzidine is obsolete now, because it is carcinogenic and it used to cause bladder cancer. Okay. So, nowadays we use orthotolidine to detect the blood, and both the principles are same. For benzidine or for orthotolidine, the principle is same. What is the principle behind these tests? Peroxidase activity of hemoglobin. Okay. So, in case of intact hematuria where the intact RBCs are present, we might need to heat it up initially to rupture the RBCs and to get hemoglobin, and in case of hemoglobinuria, the urine will be pinkish or light red in color, whereas in gross hematuria it would be bright red. So, this sample is bright red. This sample is bright red, and by seeing it, it seems like blood in urine. But there are other drugs also which interfere with our system and eliminates red color urine. Not always hematuria, but rifampicin is a drug which leads to orange or reddish urine. Okay. So, that urine is not because of hematuria, that is because of rifampicin drug use. So, we need to take history. If we find any indoor patient passing red urine in urine bag, we might confuse with whether it is hematuria or patient is having rifampicin. So, we have to take proper history. যে কোনো ড্রাগ হিস্ট্রি আছে কিনা পেশেন্ট রিফাম্পিসিন ইজ আ মেজর ড্রাগ ইউজড ফর টিউবারকুলোসিস, ঠিক আছে। আর ইন্ডিয়া ইজ রিচ ইন টিউবারকুলোসিস, তাই মানে খুব বেশি পপুলেশনে রিফাম্পিসিন হয়তো ইউজ হয়, তো সেক্ষেত্রে পেশেন্টকে একবার কনফার্ম করে নিতে হবে যে whether he is in rifampicin therapy or not. Okay. So, এবার হচ্ছে আমাদের প্রিন্সিপাল, hemoglobin acts as peroxidase. So, peroxidase leads to release of nascent oxygen from H2O2, and that nascent oxygen reacts with orthotolidine to give green color. So, and the procedure for orthotolidine test, 1 ml orthotolidine with 1 ml H2O2 and add drop by drop sample. ঠিক আছে, এটা আগের দিন প্র্যাকটিস করেছিলি তোরা? করা হয়নি, ঠিক আছে। আজকে তোরা গ্রুপ করে করে কর, 4 জন এটা কর, 5 জন ওটা কর, কিন্তু সবাই করবি, ঠিক আছে। ওকে। করে কি ফাইন্ডিং আসছে আমাকে দেখাবি।